think today's episode would be great for anybody who wants to, hear a little bit about the balance between supplementation, medications, common health conditions that can cause, symptoms that need to be treated at their, sort of root cause. I know that phrase has gotten different associations with it, but kind of looking upstream, like we talked about, maybe the thyroid issue is causing the gut issue, and the gut issue is causing some brain fog, things like that are related that you really have to dig deep into to find out, what's causing it, and then to live the life that you want to.
All right, welcome everyone to a new episode of the NeuroFlex podcast. I am your host, Toby Passman. Just want to let you guys know that we are going to have a booth at Canadelic, the upcoming cannabis and psychedelic conference that's taking place in Miami, Florida, from February 2nd through February 4th. There's going to be some amazing keynote speakers, Paul Stamets, James Silva, a lot of really cool guys talking about cannabis, psychedelics, and a lot of other wellness related topics. So hope to see you guys, some of you guys there who are in the South Florida area. Again, that's taking place February 2nd through 4th. We'll have a booth, be doing some brain mapping and some brain education stuff there. On to today's show, we have a very special guest, James O'Hara, who is a nurse practitioner with a passion for evidence-based, individualized medicine. He utilizes an integrative approach which combines lifestyle interventions, supplementation, and medications when indicated to empower patients to feel better and live longer, healthier lives. So James, welcome to the show.
Yeah, Toby, thanks so much for having me on. Really excited to be here.
Of course. Yeah, so I'm curious to hear what originally drew you into medicine.
Yeah, so my background in medicine kind of starts on the patient side of things. So growing up, I broke a lot of bones. So as a result of that, I was in a lot of ERs and doctors' offices. And one in particular, one fracture that I had, I ended up developing a complication called compartment syndrome. And for the listener, that is where essentially you have a very large amount of swelling, and it sort of closes off a muscle compartment and compresses the arteries, so you don't get blood flow to the hand, for example, in my case. So you have the potential for some nerve damage there, tissue necrosis, things like that. The hallmark sign is excruciating pain. So that was a pretty profound experience for me. Fortunately, I had a very good mother, one that got me to the hospital, and then also a very good surgeon that performed the emergency surgery called a fasciotomy, where essentially they not just cut into the skin, but cut through the fascia, which is kind of like the skin of the muscle. And then that releases the pressure and blood flow is restored. And fortunately, I don't have any sequelae of that, any negative consequences, other than a couple of scars that remind me that I was very lucky.
Very interesting. So that was like an acute case of compartment syndrome that you had.
Yeah, it was a bit abnormal. It wasn't immediately after the fracture. It actually happened after I had a rod placed in the radius to stabilize that. It was after that surgery that I developed the swelling. Typically, it follows the acute trauma, like right after somebody fractures the bone, then you see that swelling in the compartment syndrome. But yeah, it was a really interesting experience, and that's part of what steered me into nursing, because I was in the hospital and it was really the nurses that were there a lot of the time, and really good nursing program in Southern Illinois where I grew up. I believe it is or was number one in the state for a while as far as the board pass rates. So it was a good fit. And I was like, oh, I can do this. I can help people. And I always like the sciences. And I think that's really what tilted me into medicine. It actually started off in orthopedics when I started working as an RN inpatient in the hospitals, naturally with my broken bone experience, although this was more of the joint replacement and that sort of thing that we were doing at the time. And part of what I remember about that is the mindset shift that people have when they're going in for a procedure like that, because they're used to this sort of chronic pain. Probably had pain for 5 or 10 years, if not longer, and it gets worse, right? Each year, it's kind of a degenerative process. But then they come in and they know that they're going to have the surgery done, and they wake up and there was always pain after the surgery, but what patients told me was it was a different pain. And instead of knowing that it was going to get worse and worse and worse, they knew each day things were going to get a little bit better. And I think it was that kind of hope that I always try to capture, even in my patient interactions today, because people have to have something to kind of, attach to and to look forward to, finding, hope or meaning, whatever that means to an individual person in order to really move forward and kind of have that shift towards a really positive outlook, I think has a profound impact on health.
Yeah, without a doubt, without a doubt. It's interesting. I mean, I was really curious that with the compartment syndrome, because I actually had back in high school, I had like a chronic case of that. So I thought that, I was told that I had like shin splints and did all the different exercises and iced and everything, and it just didn't get better. And then I did like that, whatever it was, that pressure test where they stick, I don't know if you had like the big needles kind of testing, I guess the pressure of the fascia against the muscle, I think. But yeah, so that was saying I also had a fasciotomy. It was, more of chronic case, whereas yours, it sounds, it's rather acute, but not too often that you talk to other people who've had that similar experience. So yeah,
Yeah,
I
that's
won't.
really a coincidence. In your case, it was in your calf area. Sounds like with
It
the
was.
mistaken as shin splints.
Yeah, sort of like the shin, like I had an incision kind of like lower down, like by the ankle, and then also one like higher up, sort of closer to the knee, on
Mhm.
each leg. But yeah, exactly what you're saying. Kind of they go in, slip the fascia, relieves the pressure, and I also ended up feeling way better afterwards. I didn't have those recurring problems. So that's really cool that that was sort of you used that experience and that kind of fueled your your career into medicine. And I wanted to highlight something, or kind of explore further something that you mentioned, just in terms of, the sort of the process, or the importance of like having hope, as a patient, and that sort of leading to, recovery. Can you speak some more on just like if someone, has been given like a diagnosis where they feel like, oh, like, it's just there's such a slim chance of living, or they just get to a point where they don't really feel like they're going to recover, versus someone who, on the other hand, is more optimistic. Like how big of a role do you think that really plays in patients' recovery?
Yeah, I think it plays a really big role. You look at some of the like baseline characteristics that people have, and if they have more positive affect and more optimism, then they tend to have better outcomes. Even going into things like a cardiac surgery, for example, people who have like subsequent or even pre-existing depression, that is something that you want to be managing very carefully, because that can have a negative impact on their systemic health, which, a lot of people are like, well, how can that be? Because, there's this kind of misconception that the brain and the body are separated. But yeah, I think mental health is a really good example of something where the mindset is really important. And a term that I hear more and more now is people talking about like a sick identity, or yeah, I guess this is back in like the 90s and early 2000s, whenever there was this shift towards, more acceptance and more diagnoses of things in the mental health field, which I think that was a positive, because then there's less stigma associated with it. People are getting the care that they need for things like, depression or anxiety or other mental health conditions. But then there's kind of this, box that you're put in. And it's like, well, you're just depressed, and, this is kind of the way you are. And a lot of the focus, if you listen to some of Martin Seligman's work, he talks about the focus was on making miserable people less miserable, and not really pushing through to make people live fulfilling lives. So it's like, what is really bringing people meaning? And it's not like everyday pleasures. Like if you go to an amusement park, right, you feel good for a day, but that's not going to make you feel good 365 days a year if you're going to an amusement park once a year. It's really about finding small, meaningful things, and then a larger sense of purpose. So whether that's your, work that you're doing, or whether that's a hobby that you have, or even something like, this podcast, which is kind of both, where you're giving free to the public, education, information, interesting things that, people are otherwise probably not going to learn about.
Right, right. And yeah, so Martin Seligman, I believe he kind of founded the field of like positive psychology, if I'm not mistaken. And that it's such an interesting thing. Like just my background is in psychology, and
Yeah.
psychology focuses so much on like abnormal processes, what happens in the brain, or what goes on when someone's mental health goes awry, and how to correct that rather than like the focus on like, okay, how about wellness optimization, improving the health of the brain. So it was a real paradigm shift. I remember just in learning about his work. So I'm really happy that you brought that up. And it definitely seems so important just in our current day and age, like with like it seems like people, I mean, uh, obviously there are things that are still deadly out there, that do like, in the Western world, kill people, but it seems like for the vast majority of people, it's like chronic diseases that they're dealing with rather than, necessarily like really acute things that may have plagued, society, decades ago. So it's people kind of, they have decent health, but they might not be like living a fulfilled, like optimal um, life. They might just be kind of settling for subpar health. And it seems like just with people kind of taking more control of their own health and like the biohacking kind of movement that's going on today, it seems like people are really, pushing more towards that like health span rather than lifespan.
Yeah, I think so. I would say over the last 5 years, probably there's been more interest than ever in taking a role in somebody's health. And the kind of the two ways I look at it, sometimes I'll describe just the environment that we live in as kind of, this is the algorithm that somebody's plugged into. And if you just kind of coast through how, in Western society, the algorithm is set up, you're going to work a sedentary job and you're going to have access to lots of processed foods that are very calorically dense. So when people are kind of coasting through that algorithm, that's what's going to kind of lead to that chronic disease and a decrease in health span down the line. Really interesting Harvard paper several years back. I was just looking at 5 things that predict you'll live about 10 years longer on average. I don't think it was quite as long for men, maybe 8 years, something like that. But it was diet and exercise, number 1 and 2, healthy body weight, which kind of goes right along with that. And then, avoiding alcohol and then avoiding tobacco smoke or cigarette smoking. So, there was a lot of public health initiatives that I think have done a lot of good, getting people away from, tobacco and cigarette smoking. Nicotine is kind of debated because pure nicotine, unless you have a reason to not have vasoconstriction, may convey some neuroprotective properties. It's kind of a gray area at this point in time, in my opinion. But it's definitely preferable to have someone using nicotine over cigarette smoking. But it's just those simple things that are going to greatly extend somebody's lifespan. But then more people are interested in, well, I don't want to be 70, 80 years old and getting around with a cane. I want to still be able to travel and do the things that I want to do. And I think that there's so many good tools out there for people to use now. We know that how fit and what your bone density is going to be at your peak in your 30s and 40s is going to predict how long you can maintain those activities that you want to do throughout your life.
Interesting. And the bone density we have in our 30s, I would assume is probably very affected by our activity level, how much we're working out kind of our whole life up to then, maybe along with some genetic factors.
Yeah, the vitamin D receptor is one genetic factor. It basically correlates with what somebody's peak bone density is going to be regardless. But then it's also, you have these controllable variables, right? So genetics for right now are not controllable. Who knows where CRISPR will take us, but that's something that's exciting to watch. But as far as like, resistance training, particularly people who are lifting heavy weights, and sometimes even see this in the blood work. If I have a power lifter, for example, and I'm seeing their blood work, sometimes I'll see an isolated elevation of alkaline phosphatase. And this is an enzyme that is produced by the osteoblasts that are building bone, because you actually need a alkaline environment to do that. So in different populations, you see that elevated, and like if someone's having a fracture, you're going to see elevated alkaline phosphatase, or if someone's really putting a lot of stress on the bones, you see that. So you can actually modify your peak bone density I'm not sure what the percentage is there, but by doing resistance training, before you're 30, you can get a higher peak. And then doing that after 30, after 40, you're going to be able to maintain and prevent that. Not entirely, because we're all going to lose a little bit of bone. We're all going to lose a little bit of brain mass, but you want to lose as little as possible as you increase in age. And the activities and the lifestyle is really going to dictate most of that.
Right. And so touching on another thing that you mentioned there was, alcohol. And it's something that I was curious in terms of, is that, accounting for just like, kind of like a drink or two a night? Is that like, because there's still, I feel like, despite seemingly so much evidence to suggest that alcohol is definitely not a health food, it is not contributing to our health in any way that I've heard of. It seems like there's still debate as far as like, a glass of wine or two a night, potentially some people, stating that it confers some kind of health benefits. Do you buy that at all based on kind of the literature that you've seen?
Yeah, with the Harvard study that I was mentioning, that was looking at like excessive alcohol use. So,
Mhm.
probably if somebody is having, a drink or two a week, that's probably not going to convey a lot of harm. But I don't think that it's beneficial. I think, and I know that some of the data that was funded by various, alcohol companies, when they did this, they included former alcoholics in their group that is not drinking any alcohol. So that was a confounder that kind of skewed the study results to where, oh, it looks like, 1 to 2 is healthier than none at all. So, that's a confounder there. And I think that if you look at just wide epidemiology, it's probably that people who are having a small number of alcoholic beverages are having more social connections, which we know are very important. So it's not the alcohol per se, it's the individuals that you're spending quality time with, whether that's with or without the alcohol, that I think would be the net benefit there. So, it's not something that I think people need to add, 7 or 14 drinks to their stack for, health optimization. Probably, 0 or less alcohol is better than more.
Got it. Yeah, that definitely parallels the research that I've seen. How about in terms of with you seeing, what are the best like kind of like evidence-based interventions to optimize brain health?
So for brain health, there's a lot of interesting things. I mean, exercise is going to be number one, because of the cerebral blood flow, antioxidant activity, all sorts of things that exercise, activates cellular autophagy. I think that, consistent exercise is going to do more for that than, intermittent fasting, or then even if you're doing a couple of fasts per year. That's just kind of my bias towards exercise, because, there's just endless numbers of benefits there. But there are some other things, like with creatine getting some attention here lately, supplementation and various aspects of, brain function, like working memory. And I think when you see things like that stimulated, where you have a improvement in system performance, that probably underlies with improving that underlying system and kind of brain optimization and maybe neuroprotection. The effect is more pronounced in older individuals. So if somebody's 30 years old, it's going to be a very small effect size from creatine. Somebody's 80 years old, or if somebody's on a like vegetarian diet, that effect size is probably going to be larger. It's actually, rated as a significant effect when you look at that in the literature. Another thing that I came across recently was high flavonoid fruits and vegetables. So, not all fruits and veggies are created equal. Eating a banana is probably not going to be, very beneficial for your brain in terms of like getting those flavonoids, but like wild blueberries, spinach, onions, those sorts of things, they are associated with improvement in both BDNF and cognitive performance. And the effect isn't like it happens in 6 weeks and you peak. When you look at this data, it's like you get improvement up to 12 weeks, and then even further improvement at 18 weeks, which was kind of the limit of the study there. Personally, I like to take a lot of walks, try and get a lot of steps in during the day. This goes back to my nursing school days, actually, because I saw a image of, I think it was in like undergrad students probably, and they were looking at the brain activity if someone is just sitting 20 minutes before they go to take a test. then the brain activity of someone who, takes a 20-minute walk before they go take a test. And you just saw so many more regions, lighting up, lots of more brain activity. So to me, I was like, I want my brain to be, more optimized when I'm taking that test versus I was just like sitting there trying to go over flashcards for 15 more minutes before the test starts.
Absolutely. Yeah, something I really noticed in terms of my test performance and just my overall school performance was fasting. I got into playing around with like intermittent fasting during college, and I would notice like if I just refrained from eating a meal and just went into that test in a fasted state, I felt like my performance was definitely optimized, especially versus if I had like a really carb heavy meal, 30 minutes, an hour before the test, which, I think just was to me like really eye opening and against a lot of, what I'd previously heard about, oh, you want to like always eat breakfast. And so I was just curious, what if, is that something that you feel like, because I feel like fasting is still somewhat controversial in some circles, but what's your take on fasting?
Yeah, I think it's a tool just like anything else. So I've heard exactly what you're describing, where people either do like, fasting, or they move their eating window much later in the day because they really like that early morning, productivity, because they've got their morning cortisol spike and they don't have, carbohydrates or insulin, things like that, that are shunting them towards more, glucose metabolism. Depending on how low carb they are, they might have a bit of, ketosis in the morning, or they might be on a ketogenic diet. And some people will, absolutely rave about the mental clarity or the improvement in mental health that they get from something like that. And I've seen, Chris Palmer, the psychiatrist, bringing this more to the forefront now. And it's really interesting, just kind of bringing the mitochondrial dysfunction to the surface again. So hopefully that gets investigated as a result of some of the work he's doing. But, I've seen, a lot of good things with fasting and intermittent fasting. If I'm looking at someone who, doesn't have any, GI problems where they might need to have more bowel rest per day, like somebody who's like getting bloated, constipated, they just have like overloaded their gut. Maybe they needed to have like an 8 or 10 hour eating window, give their gut more time to rest, use some glutamine to repair tight junctions and things like that. Then for those people that don't have any symptomatology, if you like intermittent fasting, go ahead and do it. If you don't, then I don't think there's anything wrong with, having a, early breakfast, as long as you're functioning well when you're doing that. So it really goes down to, individualizing, the diet. And a lot of people do just fine with, 3 or 4 square meals per day, getting their protein in, not eating processed foods. That's probably the biggest single thing that's going to be the hardest, just because of the availability in the environment.
Yeah, definitely. And I'm glad you brought up gut health, because that's, when it comes to brain health, the gut brain connection is something that has really come to light. I feel like in the past like 5-10 years, we're learning so much, and so much about how different different balances of bacteria are actually impacting our mental health. So I'm curious, for kind of repairing the gut, healing the gut, what are some of the most important things, steps that a person can take?
Yeah, so basically looking at like a food diary can be very helpful, especially if someone, they can either do this and try and figure it out on their own, or have a food diary. It's like, okay, this is what I ate, these are the days that I had symptoms. And then even comprehensive blood work, because if somebody has you can start a cascade. If somebody has an underactive thyroid, hypothyroidism is very common, especially in women. It's probably a 15% lifetime incidence, 5-10 years ago, and it's probably gone up at this point, as more endocrine disruptors and just people in poor metabolic health are in the environment now. So that may be from 15 to 20%. But if somebody has an underactive thyroid, they're going to have dysregulated, bowel motility. It's not going to be emptying as quickly. And if the food is sitting there, that can predispose some of these bacteria that are supposed to be in the colon to back up into the small intestine. You can actually end up with SIBO. So yeah, small intestinal bacterial overgrowth is what that abbreviation is for the listeners. And when you have that, if you're like, oh, okay, you have SIBO, so here's some Xifaxan, right? It's a antibiotic they use to treat this. And there are actually some herbal preparations you can use with similar efficacy. But if you're just treating SIBO over and over again, it's like, why does this keep happening? There's probably something else that's causing that. In this case, it would be, the thyroid condition, because you've got, a sluggish bowel, food isn't moving through properly. So, that's just one example. I think that ultra processed foods have a terrible effect on the stomach. I think that ibuprofen is very common. People are taking this because they are inflamed, and it will make you feel better. Like, if you got a headache, oh, I'm going to take an ibuprofen or 3 ibuprofens. Or if somebody's got aches and pains, arthritis, but it's going to thin the stomach lining, set you up for developing an ulcer, some of the other harmful things that it can do. So avoiding things that are going to directly harm the GI tract, and then doing things that are going to nourish the GI tract over time. So one of those things is actually exercise. I was kind of surprised to see the effect that exercise had even on the diversity of the microbiome. So you have more different types of bacteria that get induced when people are doing regular aerobic exercise. It happens pretty quickly, about 6 to 8 weeks. And then when people are looking at fiber intake, if I take like 70 or 80% of the population, I won't tell them, go start eating 40 grams of fiber, because most people are eating like 10. And if they go from 10 to 40, then they're going to have bloating, because those bacteria are not used to breaking down fiber. So it has to be titrated up slowly. That's why people are like, oh yeah, I tried eating fruits and vegetables, and it just wasn't for me. It caused a lot of bloating, a lot of issues. So then they go back to what they were eating previously. So those are a couple of examples.
Got it. Yeah. Yeah, that is super interesting. I actually didn't know about that research in terms of the gut microbiome and how that changes with exercise, but that's super interesting. In terms of like alternatives to ibuprofen for someone dealing with pain, what might be some more natural anti-inflammatories that don't disrupt the gut?
Yeah, so I've actually had a number of people that seem to rave about omega-3s, specifically the EPA having anti-inflammatory properties. And I'm not necessarily anti, NSAID. If you're taking ibuprofen, once, twice a month, that's a little bit different than chronic use, where a lot of people will develop, chronic kidney disease if they're chronically using these things. But there's topical formulations of NSAIDs as well. Generic Voltaren, which is called diclofenac now. You can use, they've studied this where you can use 1 gram a day for like 4 times a day, and you have a blood level that's going to be 17 times lower than if you were taking that orally. So it can be a good option for people who do have some arthritis that need an anti-inflammatory like that. But yeah, I mean, if you eliminate, there's been some trials with lower carbohydrate diets that lower insulin in people who have metabolic syndrome, and like specifically with the knee osteoarthritis, knee pain and knee function outcome, where they see like interleukin-6 comes down, knee pain is better, the mobility is better. Those are some really interesting things that I think are more on the, the foundational, like you can do this from a lifestyle standpoint, and, that way you're not reliant on, ibuprofen or even some of the more selective NSAIDs. Those still tend to cause some kidney issues over time.
Awesome. What about cannabinoids, THC, CBD? I know a lot of people use those to manage both kind of acute along with chronic pain. What's your perspective on those, kind of based on the research you've seen?
Yeah, I've seen papers come out on both sides. I think earlier this week, even I saw one where like cannabis use was associated with a reduced number of opiate prescriptions. So like these people in this database that self-reported using cannabis were less likely to be prescribed opiates. And, there's some confounders there. I don't know whether that's because, providers are like, oh, this person is using, cannabis. I don't want to prescribe them oxycodone because I don't know how they interact, or if these people are really having, better pain control as a result of that. I think there have been some really good papers, for people with, anxiety, sleep issues using the CBD specifically, that it is effective, and they report improved function, reduction in pain, all those sorts of metrics that we look at as clinical endpoints. So I think there's some promise there. As far as the biggest issue, it may come down to what is reliable, just like with supplements. If the, let's say the vitamin D you're taking doesn't have that much vitamin D in it, you're not going to get the milligram per milligram effectiveness you need, or in vitamin D, in this case, a microgram effect. Same thing with CBD. There's probably some quality control things there, and it's not something that I am intricately familiar with. So if somebody wants to try something like that, probably the themes I would stick to would be what's a company that's well established, been around for a long time, do some sort of third party testing, just like with supplement brands, how you would sort of vet those.
Yeah, without a doubt, without a doubt. I've definitely seen some stuff out in terms of like I think CBD products that they did some like third party external testing, and they didn't have nearly the amount milligrams of CBD that they're claiming to have in these products. And I was like seen in a lot of different products across the marketplace. So yeah, I think I definitely echo what you're saying about finding a good quality brand that is accurately representing the product that they're selling. I'm curious, like when it comes to supplementation, it seems like it's sometimes something that's pretty polarizing in terms of some people are in the camp of like, let me take every single supplement. They're taking 100 pills of every single different thing, and then there's on the other side, there's people that are like, no, supplements don't do anything. I can get everything I need from eating a healthy diet. So I'm curious where you fall sort of in that spectrum on supplementation.
Yeah, I've certainly seen those lists from patients like you're talking about, where somebody's got 40 different supplements. And my question is, when somebody gets a list that large, if they can go through and say, okay, what did you start taking this for, and what specific benefit did you notice, or what change did you see in your blood work? And a lot of times people are like, well, I just kind of heard about it and started taking it. And then like, we're basically going through the list and talking about, okay, well, what can this possibly help with? Is this really necessary? I mean, if you're taking 15 different antioxidants like astaxanthin, N-acetylcysteine, vitamin C, turmeric, probably some of that is going to be redundant. And they're all, good things in isolation. They have anti-inflammatory, antioxidant effects, but at a certain point, it can be a really high pill burden, and people can get a little bit obsessive about that sort of thing. So basically, it's looking at targeted supplementation. So I think for the vast majority of people, if they have exercise goals and want to promote lean body mass, creatine, is a no-brainer. It's very cheap. Get the monohydrate powder. Use it 5 grams once a day, 5 days a week, something like that. I don't think that everybody necessarily needs a multivitamin or like a greens product, because if somebody's eating a pound or two of like fruits and vegetables per day, they're probably hitting most of their macros, as far as like B vitamins, trace minerals, magnesium, especially if they have leafy greens. But some people, if you actually go into an app like Chronometer, or some of these other ones that actually show you micronutrient breakdown, you can see like, oh, well, I'm just, I'm not hitting my magnesium, but I'm just not going to. Like, some people are very set in their diet. They're like, this is what I eat every day. This is my routine. I don't want to try and rebuild that whole thing, just hit magnesium. So they'll add some magnesium with meals or take some magnesium before bed. I think that makes sense. Personally, I take a half dose of a multivitamin, and I think I have a pretty solid diet. So that's kind of my way to, hedge. It's like, well, a little bit of extra B vitamin is just, it's going to be water soluble. It's not going to do any kind of, harm. But if I see people taking high doses of, vitamin E or, vitamin Ks, the vitamin D, we can measure that pretty easily, but you want to measure the other ones too. Make sure that they're not getting into like a vitamin A toxicity, because those are fat soluble vitamins, the A, D, E, and K. And you can actually get too high of a level of those things. They build up, especially if somebody's maybe eating a lot of liver, for example. So that's kind of how I think about supplements. There's a million of them. Probably about I'd say 20 to 30 is kind of the catalog, if you will, of things where I'm like, okay, yeah, I'm frequently like using this for select populations, like for someone with PCOS, which is polycystic ovarian syndrome. Something like myo-inositol is very effective for decreasing those levels of excess androgens. So that's sort of something that I will frequently recommend for people, that could be used, perhaps in place of something like a metformin if they're having GI issues with that, or just want something that's a little more natural. And there's not necessarily anything wrong with using a metformin for PCOS, but there's always alternatives. You can find things in the supplement realm, things in the medical realm, and things in the lifestyle realm as well. So kind of bringing the best of all three together.
Yeah, no, I definitely appreciate that approach, and in terms of whatever works and has the best safety profile. I mean, that seems like what I would want to go with. And it's interesting, I mentioned in your bio how your kind of integrative approach where you're combining different lifestyle interventions along with supplementation and medications when indicated. And I'm curious, like what is your approach when it comes to or do you always like try to start people with more natural means and then move on to medications if that isn't sufficient? And then also kind of what is your take in terms of, like, we hear, I guess, some people just talking about medications just always being bad, but at the same time, definitely in like the work that I do in the mental health field, you say whatever you want about some of these different medications, but I've had countless patients tell me about how an SSRI has really like saved their life, or been very effective. So I just am curious to hear your perspective on all that.
Yeah, I think that medications like SSRIs are very important. I mean, they've saved countless lives at this point. So, like if I have someone that comes to me with, a little bit of, seasonal affective disorder, they get kind of winter blues, then I don't think they need a, max dose SSRI right off the bat. Maybe they would do well with some, saffron, omega-3, specifically EPA, making sure that they're using a light box, or getting outside in the morning. It can be hard to do in the winter, so there's always alternatives there. But some of those more natural things, as opposed to like, oh, you need a medication for this. And there's kind of this perception out there that all supplements are safe, and then all medications are dangerous. And basically they're the same purpose. You have a symptom or something you're trying to improve with either medication or a supplement, and you just have much more data on the medication side typically, but that doesn't mean that supplements are ineffective, because a lot of the, I guess, supplement critics will try to point to, oh, well, you don't have a trial with 15,000 people, and it's just never going to happen in the supplement realm. So I think that SSRIs certainly have their place. If I have someone with profound depression and I tell them, hey, just go read a book about being positive and take some fish oil and some saffron and come back and see me, I think that's a disservice probably, and we need to talk about what some more potent options are. So that could be an SSRI, and always take the patient preference into account, because if you collaborate with a patient and put together a plan, I'm sure just like you collaborate with someone on their cognitive goals, then you're going to have a much better outcome. So if somebody is very like, hey, like I used this in the past, or my sister took this and really helped her, and I'm in a really rough place right now, then yeah, maybe low dose of an escitalopram or something like that. Starting low, increasing as needed, can be a really good catalyst to kind of get somebody going, and then take a step back and say, now what about your environment do we need to change so that this doesn't recur? Because I think that's where SSRIs would really shine, like a 6 to 12 month treatment course where people can feel a little bit better, have the energy to do the things they need to do, where every day doesn't feel like a massive chore and things take more energy than they should. And then step back, and while you're healing, which isn't always going to be linear, but while you're healing, to then like build out your environment, or kind of plug into the algorithm that is going to lead to happiness and the resolution of the depression in the long term. So I think that what happens a lot of times is, in traditional medicine, they really are trying to do the most good for the most amount of people in the smallest amount of time. And a lot of times, if you've got 15 minutes with a patient, then you come in feeling kind of blue, and well, here, take an antidepressant, you'll feel better, because you don't necessarily in the traditional model have time to dissect somebody's diet, exercise routine, and what stressors they have, and if they had any trauma in their past, and all these sorts of things. So I think there is a time and a place for them. And some people I've talked to, they do better on SSRIs. They're like, yeah, I'm just going to take this because my mood is always better, or I have less obsessive tendencies, or whatever it may be. They say I'm just less irritable. I'm nicer to people when I take this. So I think that if it allows them to live a better quality life, then I'm all for it.
Yeah, no, I really can appreciate that approach too. What it's interesting, just you being a nurse practitioner and someone obviously who's also very plugged into all of these different like holistic modalities, incorporating all of this stuff together. What sort of drew you into that versus maybe more traditional Western medicine, a role of a nurse practitioner where you're, maybe just prescribing medications. I mean, I'm not as far as I'm not positive in terms of the exact details of what that entails, but I could imagine that the majority of nurse practitioners at this point aren't like into this like integrative medicine that you are. Is that an accurate remark or?
Yeah, I would say so. As far as, if you go through the same, allopathic training. So you manage, kind of the holy trinity of primary care, which, I'm a family care nurse practitioner is my credential, which is, high blood pressure, diabetes, high cholesterol. Those are really the Western characteristics and disease states that you're treating. And those are, treated with, medication and lifestyle is always added in there. I mean, it's not that, people never talk about that at all in a traditional office visit. It's just usually, a sound bite. So, the move more, eat less, like, yeah, people, did that and that was helpful advice. Then, it's not incorrect advice. It's just not particularly specific or actionable for people. I think that's the problem. But a couple of key moments when I look back to my training when I was with internal medicine and family medical doctors, physicians, and doing my clinical rotations, there was a couple things where I was like, this doesn't make a lot of sense to me, or I guess this is just the way things are in the traditional model. The patient on metformin and then a proton pump inhibitor. And I was like, oh, like we should probably check for a B vitamin deficiency. And they're like, well, do they have any symptoms of a B vitamin deficiency? And I was like, well, no. And they're like, well, then you don't check for it. So I don't think every physician out there is practicing like that, but I definitely saw a couple of pieces of, I guess, a couple of patient cases like that, where it's like, this isn't the exact way that I want to practice medicine. So, finding something that was a little bit outside of the traditional model, just a really good fit for me, being able to spend more time with patients and then really collaborate with them more so than be like, here, do this for this because I'm the provider.
Yeah. And I mean, just, I think what you mentioned there, those big three, issues in the Western world, you mentioned obesity, type 2 diabetes, and high blood pressure, right? So, I mean, those we know are so, there's such a big influence of diet and exercise, just lifestyle interventions. It seems kind of crazy to be treating those different conditions purely through, pharmaceuticals.
Yeah, and you can look at it a couple of different ways. The way that makes me feel a little bit better about it is thinking of it like, harm reduction. So if I have someone who is, let's say they're using heroin, then harm reduction for that is like, hey, you should probably have some Narcan on hand, or people that are around you have Narcan on hand in case you overdose. So if you have somebody who is obese and, they've been counseled, maybe not the best counseling, but they've been told, what to do for, weight loss and to get healthier, and they're not doing that, well, then we certainly don't want them to have, high blood pressure and high cholesterol and diabetes, and then, have an amputation and kidney failure early. So the medications are sort of a harm reduction that's secondary to basically the damage that's caused by lifestyle. And it's a really unique space that we're in, because if you look probably 40 years ago, I think is when, the weight gain and overweight and obesity really kind of took off. And it's, people will say that, it's not really well understood. I mean, on the surface level, it's very simple. People started eating more calories and had more sedentary lifestyles, office jobs, driving cars, not bicycling, walking, not working on farms, that sort of thing. But then if you look at, well, why is that? So like, why are people consuming more calories than they need to sustain their nourishment? That's where it gets to be really, complex. And there are complex interactions between, hypothalamic hunger signaling and the, fast food environment that we have now. I mean, if you go to, somewhere in, Africa, for example, and you put up, a fast food restaurant on every corner and give people a $60,000 a year salary, you'll see the same things happen because it's the same environment. So I don't know if that's a conversation that the public is ready to have yet, as far as like a public health initiative where, hey, these snack foods like Doritos and Twinkies, like these need to become non-nutritive, where they actually don't have calories in them, so that people are not gaining excess weight. But that's probably the way that things will get reversed. Um, just my speculation, because I don't think it's feasible to put, like 200 million Americans on weight loss medication to correct an environmental issue. That may be the best harm reduction solution in the meantime, but I think long term it's going to have to go towards health policy, and then basically people. I think it will start with the family as well. So if you have a pattern of like raising healthful behaviors yourself and raising your children in a healthful way, then I think that'll have positive effects that ripple out too. Because I don't want it to sound like that people are powerless, that they have no ability to control over this, because we all make decisions every day, and sometimes we don't make the best decisions, and that's okay. It's important to just get up, try again, and keep trying and not give up.
Yes, I definitely echo that. Well, James, do you or is there anything missing from this whole picture of health that we have not yet touched on that you think is really important for listeners to understand?
Yeah, I will say that people should still establish with a good primary care provider. The healthcare system is very effective at detecting things that are going to cause you harm and then trying to mitigate those things. And it may take a while, but finding a provider that really resonates with you and can be a partner in building your health out together, I think is very important. Whether that's a physician assistant, nurse practitioner, or whether that's a physician, having a partner in the traditional medical model. And then there's a lot of like personal trainers, health coaches, people like yourself who are doing work in cognitive optimization. There's all these other sorts of subspecialists out there. A nutritionist can tell somebody way more about altering their diet to get to a certain goal than I can, just because that's not where my education is hyper specialized. Just like you can tell me way more about brain waves than I would ever learn in any kind of traditional training. So finding the specific specialty that you need to work with to get to your goal, I think is really what's high yield for people. And then I do think regular blood work is important. That way, establishing a baseline, and then checking for some of these other things that are not commonly tested for with your primary, like if you're looking at screening for pre-diabetes, fasting insulin is a cheap test. It's a good way to do that. That way you're not catching just the glucose rise when you've been kind of pre-diabetic for 5 years, but you kind of get the canary in the coal mine, before you actually start to see these things manifest. And sooner is always better than later. The old quote goes, an ounce of prevention is worth a pound of cure. And I think that really holds true.
Yes, definitely. Well, awesome, James. I really enjoyed having this discussion with you. And, for listeners who also enjoyed it, where can they connect with you, find out more about your work? Where can they head to?
Yeah, so I try to put out information on my Instagram page, which is at James O'Hara NP, just little health tidbits and scientific things that I find interesting. I also co-host the Gillette Health podcast. You can find that on YouTube, Apple Podcasts, Spotify. And then my clinic that I co-founded is located in Kansas City. We also do telemedicine, and that is GilletteHealth.com will be the website for anyone who wants to find out more information about that.
Awesome. We'll definitely include links to all those in the show notes. And James, yeah, I just really, really respect what you're doing, and just the evidence-based approach, not negating one modality and in terms of, just supplementation or just medication, and really just taking a holistic approach in terms of what does the evidence say, what's going to work best. So really, really appreciate the work you're doing. And thank you so much for taking the time out of your day to come on the show.
Yeah, thanks so much for the kind words, and thanks again for having me.
Without a doubt. So listeners, if you guys were listening to the episode, you can head over to our YouTube channel if you want to see the full episode. The YouTube channel is NeuroFlex. If you're watching the video, you can head on over to Spotify, Apple Podcasts, or most other major audio streaming platforms to take a look at the audio podcasts. James, again, thank you so much for coming on the show.
Yeah, it was a pleasure. Thanks for having me.